All right, today we're going to go over some stretches and exercises for a frozen shoulder. So Emily's going to be my patient here, and we're going to go over some of just the general stretches that we give here. So the first thing that she's going to start with, if she doesn't have a lot of range of motion, is going to be just a table slide. So she's going to do a table slide into shoulder flexion. So she's just going to have a seat at a high table and use a towel, a pillow, anything she has just to slide forward as far as she can until she feels a good stretch in that shoulder. She would hold this stretch for 8 to 10 seconds and do about 10 of these. So after she's done with shoulder flexion, she would go into a sideways motion. So she's going to take that arm out as far as she can sideways in that same sliding motion, holding for 8 to 10 seconds. Just working on this outside portion of the shoulder. Same thing, she would do 8 to 10 of those. Once this becomes pretty easy, she would then progress to a wall slide with the towel, just so she can get a little bit more motion out of that. So if she has the strength to get that arm up by itself, she's just going to take that arm up as high as she can, lean in for 8 to 10 seconds to get a good stretch. If she can't get that arm all the way up by herself, she's going to use her hand to assist that arm up as high as she can, and then she's going to lean into it to get a good stretch and then assist that arm back down. So she would do 8 to 10 of those for 8 to 10 seconds, and then turning sideways doing the same thing. Again, if she doesn't have the strength, she's going to use that other arm to assist. Next, we're going to go into what's called a doorway stretch. So this doorway stretch is just as it sounds. You would do it at any doorway or any corner wall of the house. She's just going to hold that arm about 90 degrees out from her body, holding onto the door, and she is going to lean herself forward, almost turning into that stretch. The further she leans in, the more of a stretch she'll get. This one we would hold for about 30 seconds, doing 2 to 3 of these at a time. That's going to stretch the front portion of that shoulder. Next, she's going to move that hand down into more of a bicep and lower portion of the shoulder stretch. She's going to do the same thing, turning her body in, holding for about 30 seconds and performing 3 of those. That's just a good stretch for the front portion of that shoulder. Next, we're going to go into some active assistive range of motion stretches. So at home, you can use anything from a dowel rod, a cane, a broomstick. So she's going to be using her good arm to push the bad arm up into a stretch. So the left arm is just relaxed. She only has a grip on that stick. She's going to take it out sideways, holding for about 8 to 10 seconds. Again, for about 10 of those. Just working on that outside portion of the shoulder. Next, she's going to work on the external rotation of her shoulder. So she's going to take a towel and roll it up and put it right underneath of her elbow. She's pinching that towel into her body, and she's just pushing the hand out, rotating outward from that shoulder. Again, holding 8 to 10 seconds and performing about 10 of those. Next, she's going to work on some of the motion of internal rotation and shoulder extension to get that arm behind her back a little bit more. So she's going to hold with both hands, pulling up until it is a comfortable stretch. Watching about trying not to lean forward as she does this and making it just a true shoulder motion stretch. Same thing, 8 to 10 seconds, performing about 10 of those. One last thing that she can do with that dowel rod is I'm actually going to have her lay on her back. She's going to take that dowel rod and she's going to hold it, and she is just going to take that stick up and overhead, holding for about 8 to 10 seconds to get a good stretch. This one can be uncomfortable, so she's going to be using her good arm to assist that left arm back and back down. To make it a little bit easier, she can move her hands closer together. That's going to make it easier for the right arm to do the motion. So those are some stretches that you can do on your own at home. Things that we can help with here at the clinic are actually just some passive stretches, which are generally more comfortable. So she would just relax this arm, and then I would take this arm through a range of motion. We can kind of help determine where she has the most adhesions in that shoulder and try to stretch those out. We can also do some joint mobilization and stretch that joint capsule to help get motion back in that capsule. And we'll also do some soft tissue massage to help with pain control and any muscle tension that might be going on. So that's ways that you can help improve a frozen shoulder at home, and some of the options that you have for us to help with here at the clinic.